Hi, and welcome to Healthy Living. We are here today with Kelly Presnell, Director of Marketing at Hilton Head Hospital. What are we going to be chatting about today?
Today we're going to talk about nursing. They are just the core of the hospital here, and Andrea McCleary, she's our Director of Education and a registered nurse herself. She's going to give us some input on what the nursing profession is embracing here at the hospital, some of the things that they're embarking on to grow their profession here at the hospital to provide great patient care.
And I understand that you all are the proud winners of an award, and we're not going to tell you right now, but stay with us. We're going to talk to Andrea McCleary and find out what that is.
Excuse me. Hi, can I get through, please?
Dr. Newman.
You know, there has to be a better way. A way to skip the ER waiting room. Like this lady over here. All she did was log on to inquicker.com to hold her son's place in line. Now they can wait at home and skip the ER waiting room. Now, which would you choose? This or this? Hold your place online at inquicker.com and skip the ER waiting room. Ooh, is that hot cocoa? Oh, help yourself.
We went to the emergency room, and thank heavens we did.
They discovered that I had 2 totally blocked arteries, and I ended up having double bypass open heart surgery. Well, I stayed in the hospital for just a few nights.
To the staff at Hilton Head Hospital, I would express the deepest gratitude that I possess. They literally, quite literally, saved my wife's life.
Hi, and welcome to Healthy Living. We are here today with Andrea McCleary, and we're talking about nursing, and we're going to talk about a lot of different parts of nursing, which is going to be really interesting. You're the Director of Education here at Hilton Head Hospital, and I'd like really just an overview of some of the things that you do here at the hospital.
Okay, my pleasure. Thank you for having me today. We do a lot at the hospital, and nursing's really changing over the years. My role really is to support and help with the systems for nursing. So clinically, yes, I'm an ICU nurse for 20 years, but I get to take that practice and then bring it to more of the decision-making table, which has been fun. So one of the things I'm really, really proud of that we're working on is shared governance, which is a journey that our nurses are embarking on. And it basically takes that clinical expertise from the bedside nurse who really sees what's going on every day and bringing them to the decision-making table.
When you talk about shared governance, how does it work? What does it look like?
It's very unique. You have staff nurses who don't necessarily have management background, may not have been on committees before, but have really a lot of clinical expertise. At the same table as some administrators, we've got our CNO, Elaine Hastings, that sits on it. I also sit on the table, and we basically just talk about what about the nursing practice is it that the nurses really want to see differently. So, for example, we have one of the nurses did a clinical ladder project, which is all part of this. We're challenged really with getting patients to understand their medications before they get discharged. There's a lot of side effects. You come to hospital, you're sick, you leave, and sometimes you get overwhelmed. So she came up with a little project where you take a portfolio and you bring it to the patient at the beginning of their stay, little letter from the director with a phone number, and then every time a new medication is given, that nurse teaches you about the side effects, and they give you that little piece of paper. So by the time you go home, you've got a whole portfolio. You've been able to review things while you're in the hospital. It's really a challenge to get it all in. So that was just an innovation that one of the nurses made.
So each patient then knows the side effects, what interacts. Everybody's sort of on the same page when they go. That makes so much sense.
It's very good. It's very good. And that comes from a nurse who's practicing every day, thinking, how do I get that information to the patient?
Well, they're really in the trenches, so they can kind of see the things that are working and things that aren't working. What are some other things? It's so interesting.
It is. It's good. One of the other things that we've been able to accomplish, and we're very proud of it here, is we did get our award for Clinical Innovation Award, and it is essentially an award for an effort that we did on central line infections in ICU, and I have to tell you, the results are that we've had no infections for central lines in the ICU 2 years and 9 months today, because today's March the 1st.
I mean, that's worthy of repeating. 2 years, 9 months, zero infections.
Zero infections for central lines in the ICU. And what was nice, it was ICU nurses, our infection control practitioner, who's also a nurse, pharmacy, physicians getting together at the table in a shared view, looking at what is it that we are not doing that is causing us to have some infections. And because of those efforts, we were able to make little changes, and then that's what resulted in our
I mean,
zero.
2 years and 9 months is pretty significant when you really look
huge.
at that. It's huge.
It's huge.
And you got an award for that also.
We did. So we're very, very proud. So that was our Stop BSI effort, and that's bringing clinical grassroots to the table, which is important.
What is nursing like? How has it changed and evolved as a profession?
Over the last few years, it is changing every day.
I told you I did a lot of my research for my doctorate and used nursing research. Their evidence-based practice is pretty impressive, and their best practices are really viewed as a gold standard.
They are. They are. And it's a profession in itself. Nurses, when they use that evidence-based practice at the bedside, patient outcomes are improved. And we've proven that over and over again. Lots of resources that allow us to access that information. So if you are at the bedside and there's something new, we have a spine program we opened up. If there's care that we need to look at or what that best standard of practice is, we've got a system that we're looking at that will bring that web-based evidence right to the bedside so the nurse can say, oh, this is how we should be doing it, and then can make recommendations.
Let me ask you a question. Are nurses, what are the roles of nurses at the bedside or in each department now?
Yeah.
As we're talking about it, I'm wondering what that really looks like in today's world of the hospital.
Very complex. Nurses are your mom, they're your scientist, they're your caregiver, they're your support person, they're the shoulder that you can cry on, they are the
Kind of family liaison?
They are, absolutely. They do social networking. They really manage the patient care from beginning to end. And if you think about it, the 23 hours that the nurse is caring for the patient in the hospital versus, the hour or two that other disciplines are doing it, they really impact how the patient, what their outcomes are. So, you have to not only be smart about what the evidence is. You have to know what you're doing. You have to be able to understand and appreciate where that patient's coming from culturally, dynamically.
Okay, that makes that
family.
Multicultural, yes.
So that plays into it. You have to understand education levels of patients.
We talked about empathy.
Empathy, the caring, the compassion. You have to know sort of where that patient is coming from. They're scared when they come to the
basically,
hospital.
as a nurse, I kind of accept you where you are today and work from that point.
Yep, we meet you where you're at. And then we move forward from there. And it goes beyond the door. We try to do what we can in the hospital to get you to a place where you can go home. But that does take some pre-planning and some thought from nursing. So there is an impact from nursing out in the community as well.
Growing up in the early 1950s, I think nurses were viewed as an extension of the physician's arm and basically there to administer the medications and be the agent of change, if you will, based on doctors' orders. Now in today's world, it seems like they're a lot more proactive, a lot more, I mean, is that an accurate point of view?
I think that's what it used to be like. And I think that nursing as a profession of itself is really come along because there's parts of nursing practice that is purely nursing. The physicians aren't the ones that look at what are your teaching needs. If you have a new colostomy, what is it that you're going to need? The doctor isn't responsible for that piece.
Correct.
They work collaboratively.
Right.
We need that. But then there's the nursing piece of it is how do I take that medical change and bring that to you home so that you can actually function and go back at least to where you came from before you came.
So one of your roles is to ensure that my quality of life remains moving forward or functional.
We hope. And if we can't make that happen for whatever reason, how do we help you cope? What things do we need to put into place? And what does that look like for you as a patient going home?
You have an ICU, CCU. Do each level, are there levels of nurses, or does each floor have a specific educated nurse for what they're doing?
Yeah, and I'm glad you asked that question. Nurses are not one generic body.
Okay.
We have specialty units, so you can be in critical care where you're specially trained to do very intensive, in-depth levels of physiology and learning on a very small ratio, patient to staff. When you're in the med-surg unit, you really have to be an excellent diagnostician because you now have many more patients. You don't go to the same level of detail, but you have to manage all the care needs of all those patients with different aspects of care. And then
that's interesting, diverse. And,
it is, and you can't just plop one nurse into another role just like that. It does require training and orientation. There are specialty units. Like I said, we have a spine surgery unit. They're highly trained in spine surgery and really recognize what it needs to look like for you to recover, where you need to be, how to care for patients.
Gosh, I would even think of things like moving it, especially with surgery, moving a patient, things that you just wouldn't normally even think about.
No, and so it does take a lot of specialized training. And then there's the equipment. So nurses aren't just nursing people anymore, they have to nurse the equipment. You have a little pacemaker, how does that work and what does that mean? And it really takes a lot of education, ongoing learning. It's very important.
Excellent career for both men and women.
Yes, and I'd like more men in the field. Be good.
And that would make a lot of sense. We're going to take a quick break. Again, we're here with Andrea McCleary. We're talking about nursing as a field. We're going to talk about some other things that are sort of adjunct to nursing.
Yes.
Stay with us. We'll be right back here on Healthy Living.
Excuse me. Hi, can I get through, please?
Dr. Newman.
You know, there has to be a better way. A way to skip the ER waiting room. Like this lady over here. All she did was log on to inquicker.com to hold her son's place in line. Now they can wait at home and skip the ER waiting room. Now, which would you choose? This or this? Hold your place online at inquicker.com and skip the ER waiting room. Ooh, is that hot cocoa? Oh, help yourself.
Hilton Head Regional Medical Center is located at 25 Hospital Center Boulevard. When traveling east on William Hilton Parkway, make a left-hand turn on Beach City Road, and the next left, Hospital Center Boulevard will be located just past the Hilton Head Library. Coastal Carolina Hospital is located on US 278 at Exit 8 on I-95. Telephone is 843-784-8000. On the web, www.coastalhospital.com.
The vision for Hilton Head Spine Center is very clear. It's to provide world-class spine care to our patients.
Physical therapists were there. They were there holding you up. It's nice.
I just love working with all of these patients and their families and getting to know them and helping them on their journey.
My life is definitely better, and I'm glad that I came here to Hilton Head Hospital.
We are back here on Healthy Living. We are here with nurse Andrea McCleary. We're talking about really the impressive state of nursing now. It's very wonderful, and all the opportunities that are out there. I know you wanted to talk about a couple of things specifically, and student nursing.
Oh,
During the break, you were like, we have to talk about student nursing because
Yeah.
there's some wonderful opportunities out there.
Yeah, and we're fortunate here in Hilton Head because we have 2 schools of nursing that are local, USCB and TCL. So this year we've really gotten an embraced arm around that program. We have 57 nurses right now, student nurses, who are doing separate clinical rotations. One of the most exciting things, I think, is we've gotten a clinical internship for nurses. So there are about 12 students who are going to graduate. They're going to be newbie nurses, hopefully, in May. What that brings to the table for us, though, is nurses can learn really what it means to be in healthcare.
Okay.
And my student nurse she was adorable. She said, "Oh, I don't know why they made us read all that stuff on nursing trends." And when she came and did her clinical rotation
She was
here,
like, oh, thank goodness I have this.
she said, "Now I get it. Now I really get it." She spent some time with the case manager, who's also a nurse, and said, "I had no idea what it takes to get a patient from the time that they come to the hospital to the time they have their plan of discharge, all the pieces and parts. You don't learn that in school." So it brought a whole new appreciation for the nursing students. So, you know, both for staff and for students, they learn together.
And what part does the hospital play in the ability for these new young nurses to come to the hospital or to come out as professionals?
We provide a lot of different things. It depends on the year of nursing school. For the final year, we're doing clinical internships where you are buddied with a nurse.
Okay.
And you are under that nurse's license, and you're learning, you know, towards the end of your practice.
So you're actually seeing patients with her?
Absolutely.
Okay.
We also have clinical instructors that come, and they have anywhere from 6 to 8 nurses that come with them, and they go to different specialty units. We have some that are in OB now.
Oh, so like an enclave that would go as a okay.
Yes. So they get to learn about babies, which is always fun. It's a happy place. And then when they do graduate, we do have opportunities for new grad nurses. And then we offer a really extensive 12-week preceptorship where you really learn how to get from school and transition to working to
actual practice.
And that makes a big difference. It's a special time, great relationship building, and it helps us develop new nurses, so when we have a shortage later on, we can fill that hole. So that's good.
Well, and we were talking about the diversity of nursing careers in the first segment, ICU nurses, CCU nurses, but you were talking about some outreach too, community outreach.
There's so much that we do. We have a clinical ladder effort here in the hospital where clinical nurses can get recognized and rewarded for doing things that go above and beyond what they do normally every day. One of those,
which is
good.
a lot.
It's a lot. One of the things that they do is community service, and we graduated 23 clinical ladder nurses this year, and they were part of 82 different community activities in the community in 2011, and some of that included American Heart participation. Relay for Life,
yes.
We've had people volunteer at VIM, Volunteers in Medicine, to do flu shots and TB. We've had CPR training for community members. There's been a lot lately requests for let's take care of our loved ones and know how to do CPR. So we've done outreach that way, teaching church groups about blood pressures, Diabetes University, a lot that goes beyond the door, and that helps keep our patients in the community healthy so they don't come back.
What if the nurses, what's their feedback and response from it? Are you surprised how much they enjoy it?
They love it. They love it. Think about it. It's a little bit of a variety from what you do every day, and you get to see how people do out in the community. When they're in the hospital, we put you in a nice, pretty blue gown, and everybody looks the same. When you're in the community, you see what that productive life looks like when you're finished.
We were talking a little bit about how nursing has evolved and has changed. In today's hospital world, most of the patients that come are really sick.
Yes.
Has that affected the education or the training that nurses need and their licensing?
Absolutely.
Are there different levels of nursing?
Not levels per se, but the ongoing education needs that's what keeps me busy and keeps me up at night. You bring in a new piece of equipment and you have to train people how to use it correctly. Patients will come in with different pacemakers or different devices, and the nurses have to know how to use those things to care for those patients in the hospital.
Is part of the responsibility of the hospital to make sure that your nurses get the Director of Education here?
Yes.
That's a good question for you. Does the hospital have a responsibility to make sure that the nurses get the training and continuing education units? What kinds of fun things? You talked about the technology, the new pieces of equipment. What are some other things that you do as a hospital to kind of keep everybody up to date? Everything.
All kinds of things. We have a system now where we're doing CPR on a mannequin, and it gives you feedback. So when you breathe in the mannequin, it tells you, are you doing it correctly? And it also includes doing CPR. So we train our nurses every 2 years to do it correctly. And
every 2 years?
Every 2 years. And what's happened is the nurses are coming out, they're a little tentative, I don't want to do this on a mannequin, but when they come out, they say, oh, now I really know how to do it right. So we bring technology to help with the learning. We have computer-based learning. We do classes.
And what does that mean?
There's a lot of great programs online, and if you like computers, it's wonderful. If you don't like computers, I teach live classes too. That helps.
Real classes. And like, what would be an example of some classes that you would teach? I think we actually have had the opportunity to go into a CPR class once, which was really fun.
We do a lot of that for both hospital employees and for the community. We've done teamwork building, because you do work very closely with
the team and coalition. Oh, that makes sense.
And that really is important in the way we deliver care.
I heard you talk when we were talking a little bit before about what nurses need to know. You talked about the multicultural aspect.
Yes.
Here in the Low Country, is that something that is you have to take in consideration as well as demographic?
Absolutely, we do. And we make assessments fairly frequently to see what is our demographic looking like. Language, obviously, is a clear barrier. Visual impairment, hearing impairment, everybody deserves to have that same level of care. So it really does take an artful, keen eye to really look at what's going on in your world. And if you think about it, in the Low Country, people are visiting from all over. So we have to not only look at our own community, but we've got to look at, okay, dynamics from Ohio or from Hawaii, if you happen to come from there.
Not mentioning any names.
Yes. So culturally, we do need to look at all of that in all aspects of care, including the end of life.
It's fascinating, all the aspects that you all are involved in, and again, talking about the decision making that you were doing and shared governance.
Yes.
Are these the kinds of things that you take up with administration and you can recommend because you're, for lack of a better word, in the trenches and see what's going on?
Exactly.
What are some priorities for you all as a profession that you're hoping are adopted or expanded?
Patient safety is the number one.
And what does that mean? I hear that term. What does that look like?
It looks like a lot of different things, but we want to make sure that when you're in the hospital, if we're going to do surgery for you, that number one, we have all the infection control things covered. We are doing the right body part at the right time.
Very important. Yes.
And what's nice about nursing is that they're becoming more empowered to say, okay, let's stop. Do we have all the right people? Do we have the right equipment? Let's check the patient, time out. And that is so important because we want to make sure that communication is there and that the right thing is done for the patient. That's probably the number one thing. And then, of course, the appropriate care at the appropriate time for patients.
And what does that mean?
You know, we take care of a lot of patients, for example, heart failure. That's a core measure. That's something that we report to the government, and anybody can look online and see how we rate. It's important for nursing to know, you know, if you've got heart failure, make sure you're weighing yourself every day, and please call us if we've got a couple of pounds that we
Taking your LASIK,
And every nurse needs to know what that looks like so we can teach the patients appropriately so they know what to do and they don't come back.
I never cease to be impressed when I talk to the nursing staff here. I think you are certainly impressive, and as always, it's a treat to talk with you. Thank you for taking time. Thank you all for joining us here on Healthy Living. Have a great day. Bye-bye.